I'm Jason Jabari. I'm the faculty director of the Clark Fox Policy Institute at the Brown School of Washington University. And on behalf of our team, I want to thank you all for joining us today. Looking around the room, it's great to see such a strong mix of researchers, practitioners, nonprofit leaders, advocates, and policymakers, and students. These are exactly the kinds of conversations we hope to foster here, bringing together people with different perspectives who all care deeply about improving the outcomes for families and youth in our community. Special shout out to Stephanie. Stephanie is both the person who is in front of the scenes doing all the work as well as behind the scenes doing all the work. So thank you, Stephanie, for this wonderful event today. And this is a lunch event, not in name only, but in reality. So grab some food throughout the event and make sure that you stay fed. I'm just going to offer a few brief remarks before we get started. I'll say a little bit about our Senior Policy Fellows Initiative. I'll talk about why we're here today, and then I'll turn things over to Dr. Stephen Roll. So today's event is part of the Clark Fox Policy Institute's Senior Policy Fellows Initiative. The goal is pretty straightforward. We're working to bridge the gap between research, policy, and community by supporting scholars as they translate evidence into solutions that strengthen child, family, and community well-being in the St. Louis region. We're not just investing in research, we're investing in the partnerships and the collaboration it takes to move evidence into practice and to help ensure that ideas and innovations taking shape across the St. Louis region can inform policy decisions and create lasting impact in the local, state, and national level. Today's discussion is a great example of that mission in action. Over the past several months, we've seen significant changes in federal programs that millions of families rely on, including Medicaid and SNAP. While many of those decisions are made in Washington, their impacts will be felt in communities just like St. Louis. That raises an important question for all of us. What do these changes mean for children and families? How will they affect the organizations providing services on the ground? And what role can local governments, nonprofits, philanthropy groups, and community leaders play in making sure that students and families are well served? Those are exactly the questions that we'll be exploring today. One of the things I'm especially excited about is the expertise representative on today's panel. We have leaders working across government, direct service, advocacy, and research, and bringing those perspectives together is exactly what these convenings are designed to do. So I'll just give a brief, very brief introduction, and we'll hear more from them on our panel. So joining us today are Adam Pearson, Director of the Department of Human Services for the City of St. Louis, Kristen, President and CEO of Operation Food Search, Marius Johnson-Malone, Co-founder and Chief Strategy Officer of Civic Insight, and Christine Woody, Food Security Policy Manager at Empower, Missouri. Before we get started, I want to thank our co-sponsor, the Center for Social Development, and everyone who helped make today's event so special. And now it's my pleasure to introduce today's Senior Policy Fellow, Dr. Stephen Roll. Stephen is an assistant professor at the Brown School and director of research at the Center for Social Development. Throughout his career, Stephen has worked at the intersection of research and public policy, studying how public policies and economic conditions shape the financial and well-being and economic security of children and families. His work combines rigorous research with a deep commitment to ensuring that evidence informs policy decisions. So whether it's Supreme Court amicus briefings down to very detailed intervention studies in local areas, Stephen has been able to really bridge the gap between policy, programs, and practice, especially with the focus on those who are most marginalized in our community. I also want to say Stephen is also someone who I've seen do an excellent job of meeting the moment. Like Stephen has some core things that he is invested in, but his flexibility in meeting the moment to serve families and youth has been really remarkable. So thank you, Stephen, for that. Okay, we're grateful that Stephen is part of our inaugural Senior Policy Fellows cohort, and we're excited to learn from him and our outstanding panelists in the afternoon. So please join me in welcoming Dr. Stephen Roll.
All right. Thanks everybody for coming out today. It's really a privilege to be able to kick off this event and to welcome you all here and to set the stage for the wonderful panelists and presenters we'll have today. And so my job in this presentation is really just to set everything up around discussion, if you haven't, about the One Big Beautiful Bill Act and the future of safety net access here in St. Louis. So I know a lot of you are probably familiar with the One Big Beautiful Bill, which I will be calling OB3 for short. But I want to do a little level setting as we begin presentations. So OB3, it's a federal policy that introduces some of the largest changes to SNAP and Medicaid in the history of those programs. The bill was passed in 2025, but most of its cuts, or most of the cuts associated with the bill are expected to be implemented by 2027. The national consequences of this will be enormous, but even when we focus on Missouri alone, the scale will be striking. So over the next 10 years, an estimated 200,000 Missourians are going to lose health insurance coverage, either through Medicaid cuts or through the loss of marketplace insurance. Another 150,000 Missourians are at risk of losing some or all of their SNAP benefits. Some of these SNAP changes in particular have already begun. Since October 2025, SNAP participation in Missouri has fallen by approximately 40,000 people. Christine is going to talk more in detail about this in a little bit. Here in St. Louis, the local impact is also projected to be substantial. When you look at just the congressional district that houses St. Louis, an estimated 30,000 people could lose access to SNAP because of the One Big Beautiful Bill Act. So how does OB3 produce these outcomes? 3 ways. First, it imposes more conditions on people applying for or receiving SNAP or Medicaid. Medicaid will now include work requirements that require some recipients to document that they're engaged in employment-related activities to maintain their eligibility. SNAP already had some work requirements associated with it, but those requirements have now been expanded. So these policies create more paperwork, more reporting requirements, and more points at which people must submit documentation. They also make it harder for people to prove that they're doing everything required to remain eligible. Second, the bill requires more frequent verification. It's not only that people will need to be working to maintain their eligibility for benefits, the states are also going to check their eligibility more often. As eligibility reviews, recertification requirements, and work hour reporting requirements increase, so there's a likelihood that people are going to miss a deadline, make a paperwork error, or have some other procedural error that kicks them off of benefits. This is what we call churn, right? Eligible people are going to lose their coverage for procedural reasons rather than true loss of eligibility. And then third, the bill is going to shift more financial risk to states. So one important example of this involves SNAP payment error rates. So the federal government is only going to continue sharing SNAP costs with states under the rates it currently does if those states keep their payment error rates, including both overpayments and underpayments, below certain thresholds. That can give states an incentive to remove people whose cases are complicated or perceived as more likely to generate an error, right? Even when those individuals may still be eligible for the program. And some of you might actually be thinking, okay, well, some of this actually doesn't sound completely unreasonable. Maybe it is reasonable that an able-bodied person who is capable of working should require to work or look for jobs or go to school in order to maintain their eligibility for Medicaid. And reasonable people can disagree on that, right? But it's worth noting that we've actually tried this already. So back in the first Trump administration, they allowed states to file for waivers, allowing them to impose work requirements for Medicaid. One state took them up, Arkansas. And what happened? Well, 2 things. First, once work requirements are imposed, 18,000 people lost their eligibility for Medicaid. 18,000 people were kicked off the program. What happened to employment? Nothing, right? There was no appreciable increase in employment. And that indicates that these work requirements, their chief function is to just kick people off of the program. They're not actually effective at promoting employment. All right, so with that as background, the question for today is, how can St. Louis respond to these cuts? And unfortunately, there's a substantial body of research on how governments, nonprofit organizations, community institutions can respond to the burdens being imposed by this bill. What we think of as administrative burdens, the learning costs, the paperwork costs, the psychological toll of trying to maintain your access to public benefits. And I've organized these strategies into a 3-tiered framework. The first tier is just removing burdens. The second is absorbing burdens. And the third is buffering families against the consequences of benefit loss. I'll just briefly summarize these in turn. So the first tier, like I said, removing administrative burdens wherever St. Louis governments or St. Louis government or organizations have some control. That can mean simplifying local programs, automatically enrolling residents in complementary services, extending recertification periods, reducing documentation requirements, making the whole process easy. And the goal here is straightforward: reduce the number of steps families must complete in order to receive help. This is the highest value strategy we have because it prevents those burdens from arising in the first place. The second tier involves finding ways of absorbing burdens on behalf of those families. So even when St. Louis cannot change the requirements imposed by the federal government, local institutions can help families navigate them. This could include training benefits navigators to work with families to understand how their eligibility might change under this bill, hiring enrollment counselors, training staff at nonprofits or local agencies who can serve as intermediaries between residents and complicated benefit systems. Those organizations can help people complete applications, satisfy reporting requirements, respond to eligibility reviews, and so on. And here the goal is to shift the administrative work being imposed by the federal government away from individual residents and onto local governments and community organizations that are better equipped to manage it. And then the third tier involves buffering families against the consequences of benefit loss. So when benefits are delayed, reduced, or eliminated, local organizations can help protect families from the resulting instability. That could include things like flexible cash assistance, guaranteed income programs, emergency assistance, food support, housing stabilization, and so on. And here the goal is to help families remain stable when the safety net becomes less reliable. Now, the good news is that St. Louis has already been a site of substantial innovation in this area. And several recent community programs show what this can look like in practice. So the St. Louis Guaranteed Basic Income Program, which I was privileged enough to help evaluate, provides an especially useful local proof of concept. For those of you who are not familiar with the program, the city offered 540 low-income parents of St. Louis children $500 a month for 18 months that they could use for any purpose, totally unrestricted cash. And this provides a striking contrast with the approach taken by OE3, right? The Guaranteed Income Program imposed very few conditions. You basically just had to meet income, residency, and parenting requirements, right? The enrollment process was simple and fast. The cash was flexible, and the program trusted parents to use it in whatever ways would best support their families. And that trust and flexibility helped families become more stable. Our evaluation found that participating parents experienced improved food security, increased savings, better credit scores, improved ability to pay their bills, all because they were trusted to use this cash in the way that best fit the needs of their families. And participants noticed and appreciated this model, right? They highlighted the easy application, the simple eligibility criteria, the privacy and the flexibility the program afforded them, and the fact that it trusted them to make responsible decisions for their families. That's important because program design does more than determine who receives help. It also communicates something to participants about whether institutions see them as capable, responsible, and worthy of support. So, as we think about how St. Louis can respond to these federal benefit cuts, key takeaway is our city cannot replace Medicaid and SNAP. We are a mid-sized city with our own fiscal problems, right? We do not have the capacity to substitute for programs of that scale, but we're not powerless. We can reduce burdens where we have control. We can help residents navigate burdens that we cannot remove. We can bridge gaps when benefits are interrupted or lost, and we can strengthen trust in local institutions by designing programs that are simpler, more flexible, and more responsive to families' needs. None of those actions will fully offset the cuts coming from the federal government, but they can go a long way toward protecting St. Louis families and building a stronger and more humane local safety net. Thank you.
Good afternoon, everyone. I am Kristen. I'm with Empower Missouri. I think the rest of the panel now is going to go using some great social work terms from the macro down to the micro level. So our organization really does focus more on policy advocacy, looking at how to change the system, looking not so much at the direct service and affecting individual lives. So I'm going to talk a little bit more about the One Big Beautiful Bill Act, the changes that have already taken place and what changes are still to come and what we can do as a community to affect those changes moving forward. So I know Stephen did talk a little bit about some of the changes on SNAP that have already been implemented. This just lists out some of the specifics about how those changes are really being implemented and who individually these changes are affecting. The bill was signed into law on July 4th of 2025. And immediately the new immigrant eligibility rules went into effect. So this list are no longer eligible for SNAP. Any refugee, any asylee, any survivor of domestic violence, any survivors of trafficking. There were maybe 2 or 3 very small subsets of the immigrant population that's still able to access SNAP program. But those changes went into effect in immediately. Missouri did take some time to go through their caseload individually to ensure folks did not have a change in status that would allow them to stay. So Missouri's did not take effect exactly in July. So I do give the Department of Social Services some props for the way that they did that. So Missouri's affected population was, I think, a lot smaller than maybe some other states because of the way the department did it. So I do want to give props to the department of how they went about that specific vision. Again, there were additions to the work, and I call it work documentation requirements. There are work requirements, but the way you get a stay on SNAP is not just working, but you have to document that work. So you have to submit paperwork, proof of income, proof of working through their online system. So it's not just working, but it's actually documenting it and showing it to the department that you're doing that. And that is part of the concern that we have, is that it's those families that have a hard time documenting that they're working. For example, you can be a caregiver, or you can do volunteering for a certain number of hours. And if the department caseworker doesn't ask you if that's what you're doing to follow the work requirements, then you could be cut off. When they just say, "Are you working?" You say no, then you're potentially cut off. But if you're taking care of a elderly parent, or if you're taking care of a sick child and you're volunteering at your church 20 hours a week, all of those could count for work documentation. But it's that communication through the caseworker that would potentially cut a family off because they just don't know. So it's, yes, these extended work requirements, but it's more nuanced than that, where I think a lot more families are going to be affected. Stephen did mention this. I think we have 1 more month of data. So we're actually over 50,000 people in the state of Missouri that have lost SNAP benefits. And that's just from August of last year. You can see on this graph that it's a pretty significant decline in the number of SNAP recipients. And this is not just, I have more graphs on the Department of Social Services website that don't just show that it's able-bodied working adults that are losing SNAP. There's a significant number of children that have lost SNAP, and a significant number of disabled individuals or seniors that have lost SNAP. So it's not just affecting able-bodied working adults. Another thing that has already is in the process of taking effect is a change regarding how the SNAP program is funded. Up until July 4th of 2025, the way that the SNAP administration was funded, so running the SNAP program, was always a cost share between the state and the federal government. So it was 50-50. This bill that was passed, it changed that cost sharing from 50% to 75% state and 25% federal, which means that the state of Missouri had to come up with an additional $29 million in the budget that was just passed with past legislative session to continue running the SNAP program in like a status quo level. I am happy to report that that money was included in the budget that was passed by the legislature in May. The governor, I believe, is in the process of signing all of his bills and budget bills this week. So I think there is a possibility that it might get struck down, but I'm crossing my fingers and I do not see that happening. So at this point, the state of Missouri has stepped up and will continue funding and administering SNAP in the same way that they always have because of those changes. So there are still lots of changes to come because of the One Big Beautiful Bill Act, and most of them are financial. And there's a lot of concern about what that's going to mean moving forward for the state of Missouri and the SNAP program as a whole. So again, in the past, the way that the SNAP benefits were paid for, so the dollars that families got on their card, was always completely paid for 100% by the federal government. States did not have to come up with any costs to cover the SNAP benefit program. In this new bill, they made the SNAP benefit cost sharing based on something called the error rate. And I think it's important to note that the error rate does not mean fraud rates. The error rate is really mistakes that have happened in what a family is supposed to receive based on all of their income and data, and what they are receiving based on their income and data. And I think it's also important to note it's a combination of overpayments to families and underpayments to families. So the state could have underpaid a family, and that is counted in the error rate. So Missouri's error rate, the error rate report actually came out about a week ago for 2025, and Missouri's error rate is 8.67. That is down. For the last couple of years, our error rate has been trending downward, which is good. But as you can see from this chart, that means that we would have to pay 10% of the SNAP benefit costs. And that is about $150 million a year. Any of you all that know the state benefit or the state budget know that Missouri does not have $150 million to pay for SNAP benefits. So that is very concerning. There is one good thing to note, that this does not take effect for another year and a half. And we have one more error rate report to potentially get our error rate down to under 6% when we won't have to have any cost share. The Department of Social Services tells me time and time again that they are working very diligently to reduce its error rate. And these are all of the things that they say that they're doing, which are fine. Training call center staff, reviewing the quality control team, which is the small team in the department that looks through cases to make sure there's no errors before it goes to the federal government, doing more automatic verifications. There is some concern about shortening the certification periods. That's when families have to call and submit all of their paperwork again and again and again. So all of those things are good. I think it's also important to note that an error is only for families who are on SNAP. So if there's been a family that has been denied SNAP or cut off SNAP wrongfully, if they are not on the program, that's not considered an error rate, which I think is where our concern comes in when they're pushing through these new changes and eligibility rules, that families are going to be cut off the program, and that won't be articulated in their error rate. So maybe we'll get the error rate down, but I think a lot of families are going to be denied SNAP because of these new changes. And I think there's still a lot of concern that our next year's error rate may even be higher or the same, even though the department says, yes, we're working on it. HR 1 had a lot of eligibility changes, which again is going to cause errors in the way caseworkers implement things, right? So they may let someone on the program when they shouldn't have let them on, or given them too many benefits when they shouldn't have given them too many benefits because of these changes. And in a lot of these changes, the guidance that FNS, which is the federal department that is regulating all of the SNAP program, has given very delayed and very conflicting guidance of how to implement these changes, which makes things even more confusing. And I think it's also important to note that the error rate report is from the year previous. So this last year's error rate numbers were actually from even before HR 1 passed. So it's not really anything that they had to do with HR 1. But next year's error rate report will also include the government shutdown in the fall of last year, where the entire SNAP program was shut down for multiple weeks. And there was a lot of confusion about how that was running, which I think caused a lot of states to have a lot of errors. So we are a little concerned about what next year's error rate will show, but fingers crossed that we can get it down below 6%. And with all of that being said, there are still a lot of opportunity for folks like us, nonprofits, direct service providers, people in the community, that we can do advocacy on both the federal and the state level now and into the fall. So on the federal level, there is the upcoming Farm Bill. The Farm Bill is a large piece of federal legislation that not only regulates a lot of farming policy and everything related to farmers, it also has an entire nutrition title, which administers and legislates the entire SNAP program. They are trying to push a Farm Bill forward. We are hopeful that we can include in that Farm Bill a delay of the cost shift for at least 2 years. I think it's the way that this bill officially got passed in July is they allowed for a delay of the cost shift for states who have error rates above 13.3%. And the way that they gave that number, so they could get Alaska to vote for the bill, because Alaska has a very high error rate. So looking at the numbers right now, Illinois has an error rate of like 14 point something %. So Illinois, under this legislation, will not have to pay any cost benefits for 2 more years. while Missouri will have to pay upwards of $300 million, even though we have a lower error rates. So we are really trying to convince legislators on the federal level that all states should be allowed to have those additional 2 years of delay. So we all have a level playing field to get those error rates down. So this is happening right now. The Senate passed their version, which did not include the cost delay. The Senate released their version that also did not include the cost delay. But there's still lots of conversations that are happening, and the vote has not been finalized, and the bill has not been finalized. So we are really working on talking to our senators about the importance and the fairness of that compared to other states who are doing worse than Missouri. Just doesn't seem fair. If we do not get underneath that 6% error rates, Missouri will need to include the SNAP benefit funding in our budget for 2027, which is legislated and passed in the spring of 2027. So that is coming up very soon. So we need to have those conversations about if we don't get under 6%, then we need to fund this $150 million. And the advocacy needs to include not just our legislators. It needs to go to the governor's office. It needs to go to the Department of Social Services. It needs to go to the leadership in the House and the Senate, and specifically our own Missouri senator or representative about the importance of the SNAP program, the importance of funding the SNAP program. Even if we are expecting the error rate to get down below 6%, if it doesn't, we are on the hook for that. And adding that in after the fact is going to be much more difficult than getting it in now. We run a food security coalition that does all of this sort of work. Empower Missouri's statewide food security coalition meets once a month, and we'd be happy for any of you all to join us in some of these conversations and work moving forward. There's a lot of work to do. So thank you all for your time, and I look forward to the panel afterwards.
Good afternoon, everyone. As part of my work at the department, I end up spending some time outside doing outreach work. So Stephen, pass my regards to the Brown School HVAC team because it feels great to visit. So really quickly, just an introduction for you all. I'm Adam Pearson, Director of the St. Louis City Department of Human Services. Within our department, we have a few different divisions. We have the administrative office that kind of runs a lot of our programming and works on the budget. Then we also have the Office on the Disabled, which serves as the ADA coordinator for the city of St. Louis. We have the St. Louis Area Agency on Aging, which serves as the primary aging services clearinghouse, the resources clearinghouse for St. Louis City. The Homeless Services Division that funds a lot of shelters and housing programs throughout the city and does have an outreach arm as well. Youth and family programs and a fiscal division that helps to manage all of our books. I think it's important to note that a lot of our work is not directly related to OB3 and SNAP benefits, but we do serve a lot of people in the community who have SNAP benefits. We have 60 team members in our department, and we manage a budget. It fluctuates each year, but it's typically a little bit over $40 million. We are primarily a funder, and so a lot of the work that we do is send funding out into the community, money that is appropriated to us via the Board of Alders, but also money that we get via pass-through entities such as the state government and also federal government for a lot of our work. So I had mentioned that a lot of what we do is working with community members and community organizations that engage in homeless services or senior services, people who otherwise would be recipients of SNAP and Medicaid services. Certainly in St. Louis City, that is quite a large number of people. These numbers are a little bit older, but as of 2023, around 18% of St. Louisans were on SNAP benefits. Medicaid, around 24% of St. Louisans. Changes in OB3 and the cascading effects in policy and the ability to use SNAP benefits will affect a number of systems in St. Louis, including the providers that actually receive or providers that actually use SNAP benefits or make their services eligible for SNAP benefits. There are 300 retailers in St. Louis that receive SNAP benefits. And so we're thinking through the effects that changes with OB3 would have on them as well as retailers. And thinking through the various systems and the populations that are affected by these changes, our unhoused population is often disproportionately affected by negative policy changes, especially the individuals who are unhoused and unsheltered, or individuals who are staying in emergency shelter, transitional housing, or otherwise emergent types of housing where it may not be as stable. Of the 3,100 unsheltered or transitionally housed individuals or other folks in short-term housing in St. Louis, around 1,100 have SNAP benefits. And I want to just pause here because I think what the changes we see mean is that there is some compounding complexity with how individuals navigate these federal changes. So one of the things that was mentioned before is that the work requirements have changed, and they have eliminated some exceptions for who has to work, and especially the amount of times spent looking for work. In thinking through our unhoused population, a lot of them do have jobs, and a lot of them may be gainfully employed, but many of them may be in housing that is requiring them to participate in treatment during the daytime. And so it's hard to sort of parse out when you're going to take the opportunity to go to work. And so the other thing that I think about is a lot of these changes are also happening at the same time that the U.S. Department of Housing and Urban Development wants to make changes for continuum of care funding. And so do you all know what the COC is? Have you heard of that? So for those who might not be aware, the COC stands for Continuum of Care. Each city or municipality that receives HUD funding has a COC. HUD sends money to these different COCs for long-term housing programs like permanent supportive housing, rental assistance, rapid rehousing. The federal government has mandated that the housing first approach, where we prioritize giving housing to people first before treatment, is not a strategy that they want to emphasize anymore. And so now they're wanting to make it where it is treatment first. And so to be eligible for your housing, you have to engage in treatment. And so in thinking through just how people are going to manage their time, you have a housing program that says you have to engage in treatment during the daytime, but a SNAP program that says you also have to engage in employment during the daytime. I don't know how to square that. And so I think in looking at our different populations that are disproportionately impacted, we have to think about some of these downstream impacts that are going to take place. In terms of assessing impact, we are also in partnership with a number of food pantries that have seen increases in the number of folks who are utilizing their services, especially this past year, we've seen increases across the board. We are also working with the Department of Health to determine to look at some of the morbidity and mortality statistics that may or may not be related to the loss of benefits, and how we want to make that connection with those treatments. So one of the things that we think about is the fixed reimbursement costs that we as a department have to navigate. So with our St. Louis Area Agency on Aging, one of the primary roles that we have is serving meals to seniors in their homes in the community. Some people call it the Meals on Wheels program. A lot of those costs for meals are reimbursable, but one of the issues is that the cost of reimbursement is decreasing in terms of how much the meals actually cost to produce. And so, for example, the cost of producing meals for the Meals on Wheels throughout the state is around $9.97. The cost for reimbursement on average across the state is $6.21. Our department reimburses at a rate of around $4.70. And a lot of this is reimbursed by Medicaid. And so if we are seeing cuts in Medicaid costs, what that is inevitably going to affect is how much Medicaid can actually cover meals. By state statute, there are certain meal components that we have to have in each food kit. And if organizations aren't getting reimbursed at the same rate as the cost for commodities is increasing, we may see some downstream impacts on the number of meals that organizations will be able to approve for our seniors. We also see that there will be increased food needs after disasters. And so within this past year, after the May 16th tornado, we partnered with a number of organizations in the community to distribute food, over 400,000 meals distributed to folks in the disaster zone. Many of them had SNAP benefits, but they just weren't able to make their ends meet after a disaster. So we have to think through those things. So some of the limits that we see in how we as a department and we as a city are addressing some of this is that the city cannot replicate the federal government. We just don't have the resources. As a city, our budget is around $1.4 billion. And I think as you all may have seen in the newspapers, there have been quite a few discussions and debates regarding our budget. And so we have a very limited pocket of money by which to address some of these food costs. We absolutely need a strong and enthusiastic and willing federal government to make up for that difference. And we unfortunately are not seeing that right now. What we do have is some initiatives in the past that we've been working through to increase food availability across the board. One of those is the Food and Security Fund that was launched in collaboration with United Way, a number of organizations that are helping to fundraise and sort of pull money into a fund to distribute out to organizations that need food assistance. In the past with ARPA, we also had ARPA money that went out specifically for food costs. And so again, those things aren't to replicate the federal government because we can't do that. But I think in terms of meeting the need locally, I think those are some avenues that we should be able to look at. So in terms of what is needed, interested to really get into the discussion about this in a minute, but I think as was mentioned before, there has to be strategic political advocacy at a number of different levels. As I mentioned before, the change in OB3 and SNAP benefits affects more than just the client. It affects grocery stores, it affects farmers. The entire food chain is affected when we cannot have the same amount reimbursed for food when individuals don't have the same access for food. And so I think that gives us an opportunity to work across the board with a number of organizations to spell out what we think is needed for our elected officials. And I think also a joint messaging strategy is needed that works across different levels, including mayor's office, including the county governments, nonprofits, individuals who are otherwise stakeholders in this effort as well. Thank you.
Good afternoon. My name is Marius Johnson-Malone. I am the co-founder and chief strategy officer for Civic Insight. Briefly, we are an independent research and data strategy firm based here in St. Louis, but we work with communities across the country to help them bring data capacity to some of the decisions that they're making to help grow their impact. So our mission here on the slide, I'm not going to read it, but most of our work focuses in areas of financial well-being, economic mobility, or systemic disparities, including education. And we work with a number of partners locally, philanthropy, nonprofits themselves. So we came to this project with our partners at Key Strategic Group, which is a social impact consulting firm, with the notion, I think, really around the One Big Beautiful Bill, but also thinking through other agendas that we're seeing at the federal level, like Project 2025 and other cuts to appropriations, that we knew were going to have a really significant impact on the social safety net landscape. And we started out with the notion of understanding what is the role of philanthropy in trying to fill in this gap. We've heard from some of the other panelists that the local government, the state government doesn't have the resources necessarily to step into that gap. Some folks were looking to philanthropy to understand how they could help fill in the gap. And so we wanted to understand what's the landscape look like from a high level perspective. One of the things is that you all are clearly aware of based on today's conversation or even coming into today is that the funding landscape is shifting faster than the people on the ground can respond to. And so how do we get ahead of that? And to the extent possible, be as proactive in addressing these concerns and really adapting. And one of the things that I want to say here that's important is I think a lot of our conversations as we talk to stakeholders on the ground initially were about how do we adapt in the moment and sort of wait out this administration. And I think one of the things that we heard both from analyzing the data and talking to stakeholders on the ground is that no, we need to be adapting to this being the permanent state. This level of uncertainty with federal funding, regardless of the political affiliation of the next administration, is going to persist. And so we need to set a new paradigm where we are expecting this uncertainty and this shifting in the federal landscape to be the new normal. And how do we operate in that reality? So I do want to acknowledge our funders, the St. Louis Community Foundation, the John S. McDonald Foundation, or James S. McDonald Foundation, pardon me, Missouri Foundation for Health, and Dana Brown Charitable Trust that allowed us to do this initial view of what are the highest risk programs. So we did a scan of these key documents, the One Big Beautiful Bill Act, the Project 2025, and identified 39 programs, federal programs, that were at some level of risk. Obviously, in trying to evaluate how do we prioritize or think about these programs initially, we wanted to prioritize and figure out what of those programs are most at risk. And so we took a lens of vulnerability to prioritize within those 39 programs where we start to understand what the landscape looks like. We looked at those programs based on the level of funding risk. So are they directly mentioned in these documents and in these bills, or has there been action at the appropriations level to cut those fundings, the funding to those programs? We looked at the populations. Are these programs serving particularly vulnerable populations, children, seniors, unhoused populations? And then also thinking about it through the lens of basic needs. So do the programs serve some sort of basic need? Thinking through like the Maslow's hierarchy of need, how are these programs constructed? And we scored each of those 39 programs along those dimensions, and 8 emerged as what we would call high priority, and we chose to focus on 5 initially. Some of these were, including LIHEAP, were timely based on when we were doing the work heading into winter of last year, trying to think through what made sense to understand at that point in time. But as you can see, Medicaid and SNAP, the programs that we're talking about here today, were 15 out of 15 on our vulnerability scale based on the cuts that we knew were coming. And at the time we started this work, we were still in the middle of the government shutdown. So SNAP, we saw a particularly acute risk to that program. One of the things that I think has to be said here is as we think about and we talk about SNAP, we talk about Medicaid or any of these other programs, that these things are not happening in isolation. Many of the people and families who rely on these programs don't just rely on SNAP, they don't just rely on Medicaid, they rely on an array of these programs. And so cuts to any one of them, or particularly in this environment to multiple programs, has a compounding effect on families and ultimately communities where there's concentrations of poverty or concentrations of people relying on these assistance programs to make ends meet. So I'm not going to belabor the numbers. Stephen did a great job of talking about the scale of the cuts across the state of Missouri to Medicaid. But in the short term, we're looking at 170,000 people losing benefits. People are losing real hundreds of dollars a month on average with SNAP. Housing vouchers, 83,000 people across the state rely on those vouchers, the Section 8 housing vouchers. And there are 13,000 childcare seats that are at risk through the cuts that are proposed through these pieces of legislation. One of the things that we did in working with Key Strategic Group is make sure that we're not just looking at the data from a numbers perspective, but what is the lived experience of practitioners at these organizations providing these services, providing food assistance or Head Start programs. And the things that we heard from them were that the dollars matter, but it was really the other administrative burdens and the other ways that these changes were being applied that were having even a more acute impact on their day-to-day operations. So lost staff time to trying to adjust to the new compliance regime, figuring out how to serve new populations of people that maybe had never reached out to them, but seeing their benefits threatened, and they're coming to them and saying, I didn't know where else to turn. Your agency popped up for us. And then really thinking about, we heard from one nonprofit leader who was concerned about, the example was there was a whole array of things that the federal government was now using artificial intelligence and other tools to search staff social media for things that might have been out of compliance, using the wrong language, using the wrong terms. And so having to be aware of a whole different set of risks to their funding for these organizations while trying to stay committed to delivering on the services that they know are central and core to these agencies and the people that that they serve. So what can we do about that? I don't want to offer only a doom and gloom picture. I think we're all aware that this is a heavy topic, but from our perspective, there are some things that we can do as a region to think about how do we position ourselves to be sustainable and respond to these phenomenon. One of them, as mentioned before, is shared awareness, making sure that everyone that has the ability to understand what the landscape is, both what's happening in real time, but what's coming down the pike. A great example of this is thinking about the Missouri budget landscape. We know that those pressures that are coming from these changes to SNAP, Medicaid is part of the Missouri Constitution. And so there will be funding pressures as the federal government dials back its own commitment to funding that program. How does that impact the rest of the state budget, these other social service programs, particularly in an environment where we see moves to shift how we pay for the budget in the state of Missouri from income taxes to other sources. So thinking about this in a holistic way. In the future, we hope to be able to provide additional analysis that doesn't just look at these programs at the statewide level, but understands at a community level how many people are impacted by these programs so that we can begin to layer on both, again, SNAP, Medicaid, whatever other relevant programs are, to really understand at a community level what is the impact. And then thinking about that through not just the funding lens, but what are those other leading indicators that we can understand, like the churn rate and other things that are happening at the administrative level to allow people to act in more concerted ways and in more coordinated ways to respond. The other part of this is that I think there have to be some tough conversations, particularly around the nonprofit community and the funding community. As I said, philanthropy is very clear that they don't have the resources to step into this gap. So how can they shift their practices to be more supportive of organizations dealing with some of these things, making funding accessible or less burdensome to pursue funding, but also encouraging coordination and alignment where we have multiple agencies serving the same purposes. How do we find efficiencies across those agencies so that we're maximizing the dollars that are coming to our community? I think our goal is to continue to build out this platform of ongoing information and intelligence that can serve to position us to respond as well as we can. We know that there's going to be no perfect response. There's going to be a lot of bumps in the road along the way, but we are committed to working with community to provide that data, both from a numbers perspective, but also from a qualitative perspective that takes into the account the lived experiences of the practitioners and the people who are impacted by these shifts, so that we are positioned to ride this out and continue to support people who most need these helps. So thank you.
Hello, everyone. Great to be here. My name is Kristen Wild. I'm President and CEO of Operation Food Search. and represent a boots on the ground organization. Really appreciate all of the comments that have been made so far. So first, just to introduce Operation Food Search. So we're Missouri's largest independent food bank. We serve about 200,000 people every month. Last year, we distributed more than $32 million worth of food and basic necessities. Our mission is really to heal hunger with innovative and collaborative solutions that both provide food today, but also look at long-term solutions to end hunger tomorrow. Our work is really divided into 3 pillars. Our first, meet the immediate need, is really our daily hunger relief work. So we do this through a network of agency partners, about 170 of which we distribute the food that's donated to us, and in some cases, food that we purchase. We also have an array of child nutrition programs. We have our Metro Market program, which is basically a mobile farmers market that goes to areas in the region where there's low food access. Our Build Nutrition IQ pillar is focused on providing nutrition information, cooking skills, really anything to help families prepare healthy meals on a budget. And then our Champion Change pillar is focused on impacting public and institutional policies that impact food security, as well as our array of food as medicine programs that are really looking at the intersection of health and food. I'm not going to go into depth about all of our programs. We've got a lot of them, but I did just want to do one call out to our Nourishing Healthy Starts program because of our deep partnership with WashU as our research partner. So this program focuses on food insecure pregnant women and their 90 days postpartum period. We provide shelf-stable and fresh grocery items throughout pregnancy and during that postpartum period. We connect the participants to resources, medical, social resources in the community. They participate in our cooking classes, and they get help with enrollment in the federal safety net programs. Really, the goal is to reduce the both the costs as well as the conditions, chronic conditions and complications that can happen to a mother when she is food insecure during pregnancy, as well as the impact of a baby who is born premature and a low birth weight, the costs that can be associated with a NICU stay. And so far, it's been quite a successful program with about 89% of the babies born last year at a healthy birth weight and really having a lot of benefits for the full families. And we're looking forward to the evolution of the partnership with WashU. We're now moving on to another stage of the program, which is really looking at participant feedback to develop sort of the next research agenda. This is just a map to show the reach of Operation Food Search. We operate in 14 counties in Missouri and 10 in Illinois. And as you probably are not surprised, and also based on what you've heard so far, food insecurity is on the rise. You know, since 2020, we've seen an increase of 25 to 30% in food prices. And then at the same time, people are losing their SNAP benefits. So really just the first item can put a strain on a family's budget, but when you pair that with a reduction in benefits, we're seeing an increase in food insecurity. In our service area, that map that I just showed you, about 14.4% of individuals are food insecure. And I think as Adam mentioned earlier, in the city itself, the food insecurity rate is about 18.4%. Particularly alarming is the fact that 1 in every 6 kids is at risk of hunger in our service area. So what we've been seeing already is an increase in need. You know, families are feeling the pinch with higher food prices, with higher gas prices. It's put a strain on really the entire community food system. You know, many of our agency partners have reported an increase in the number of people coming to them looking for food assistance ever since COVID. But it has been really unprecedented in this last year due to the effects of the tornadoes, especially during the government shutdown, and the SNAP shutdown in the month of November. We saw an increase of tenfold the number of people who were seeking food assistance, going to our website and looking at our food resources pages. I think that's an indication of just the increase in need when that government safety net was gone and paused for several weeks. Our food pantries have reported to us not only seeing more people, but also concern about how they're going to keep their shelves stocked. One of our partner agencies, St. Anthony's in the city, they saw an increase of 50% during the SNAP shutdown. They went from seeing about 4,000 people a month to 6,000. So we've had to quickly adapt. A lot of our agencies are facing the reality that they may need to purchase more food because there's obviously a ceiling on the amount of food that can be donated, no matter how generous our partners and supporters are. There's just a limit to how much can be donated from grocery stores and retailers. We have had to expand programs in this past year. One example is our Metro Market program. We in last year served about 388 markets, and this year we are on schedule to provide 666. So it's just one of our programs. This has come up in the previous comments as well. Central fact that's truer than ever right now is that the charitable food system cannot replace what the federal safety net program does. And I know that was mentioned, neither can the city. There is simply no way to replace the billions of dollars that get spent through the SNAP program. And really the charitable food system was never designed to be the first line of defense. Those are the federal safety net programs, SNAP, WIC, school meals. Those are really the programs that provide the bulk. In fact, they provide 9 times the amount of the nationwide, charitable food system. So when we saw in November when the SNAP shutdown happened, the charitable food system worked very hard, but we could not make up for the gap. Additionally, and this also has been mentioned about the grocery stores, but for every $5 in SNAP benefits, that generates about $9 of economic activity. That with the reduction of SNAP, that just reduces and has a whole, an impact on the entire food system. We like to think we're strong. Our network of partners is very strong, but we simply are, cannot fill that gap. So what we're doing right now at Operation Food Search is we're, expanding programs. We are looking to other sources of support, both in the form of food and financial support, reaching out to activate more people to come and volunteer at Operation Food Search, reaching out to other organizations to see how we can partner with them, make sure we're not duplicating services, and really encouraging, and this has also been a theme, of encouraging people to get involved and advocate, talk to legislators, and advocate for policies to strengthen. Right now, even if things were to hold steady, that would be a benefit, but to reverse some of the negative changes that are happening. Events like this, I think, are really helpful just for people to become more informed. So hats off to Dr. Roll and the department for having this event. And as negative as things may seem, I want to end on a positive note. Because Operation Food Search has been doing this work for 45 years. We have seen time after time that during times of crisis, St. Louis rises to the occasion, people pull together, and I'm just hopeful that we will be able to, as well as possible, weather this particular storm and reduce the amount of impact that a lot of families will have. Thank you.
On that note, we'd love to invite our speakers up for a panel discussion here. All right, so first one is for Kristen, Adam, and Christine. So OBA is federal law, but its effects will be filtered through state policy choices that are felt locally by families, city agencies, food providers, and community organizations. So the question is, what are the first impacts Missouri and St. Louis should be preparing for, and where do you expect the strain to show up most quickly?
The strain will be widespread. First of all, it's going to put a strain on families. It also puts a strain on the nonprofit organizations that are working to feed those families. Puts a strain on schools, which will have a higher demand for enrollment in school nutrition programs, and without potentially a corresponding increase in reimbursement rates. Puts a strain on grocery stores. Grocery stores typically get about 7.5 to 9% of their business is through SNAP activity. And with that reduction, that's going to impact grocery stores. Some in rural areas actually have about 20% of their business is through SNAP activity. So we're going to see an impact, not just on the families, most importantly on the families, but also on organizations, on agencies and call centers that are seeing more calls come in and not necessarily corresponding increase in staff who need to receive those calls and interpret new eligibility rules. So it's widespread.
I think from the vantage point of the city of St. Louis and all the different populations we serve, of course, I mentioned the senior population, aging population, but also those with disabilities and those who are unhoused. And I'm thinking about the seniors most because the number of seniors we have in St. Louis City as a proportion of our general population is going to increase. Especially these next few years, we're going to see a greater and greater number of seniors out there who would be recipients of Meals on Wheels, for example, that are reimbursed by Medicaid, where the programming is going to shift that a little bit. Also want to add that one of the things that we've learned after the tornado is the fact that a lot of folks out there truly do not have any cash savings or any liquidity whatsoever. And so I think coupled with the fact that there may be more emergencies or disasters, it's going to cause an even greater strain on how people afford food on the day of Christmas.
I think they answered it
Okay, all
more
right.
quickly than I can, so.
I'll keep moving unless Marius, you want to weigh in. If not, I'm going to keep moving here. So when we think about work requirements and eligibility checks, we think about single groups of non-working adults, but we know that many affected residents may be working in unstable, low-wage, seasonal, gig or caregiving situations. So who do you think is most at risk of losing benefits under these changes, and what can we do about it? Up for Steve, Marius, Christine, or anyone else?
Yeah, I'll jump in. And I'll talk about Medicaid in particular, although I think this applies to SNAP as well. So the first thing to note is that most of the people on Medicaid are working, right? So I think it's about 2/3 of the folks who are on Medicaid are employed in the ways that we ideally want them to be employed. Only about half of those folks are employed at the rate that would allow them to keep their benefits, right? 80 hours a week. But the core point here is that we have these work requirements that are based on the assumption that that people are not working, that's how they're getting access to these benefits, and it's simply untrue. So when I think about who's most vulnerable to these work requirements, I think about there are 4 overlapping groups. So the first group are those folks who are working, but for some reason would not be considered eligible under these rules, right? Maybe they work in highly seasonal sectors or highly unstable sectors like food service, home healthcare, childcare, retail, things like that, which is actually where Medicaid recipients are concentrated, right? In those industries, those folks have got volatile hours, they've got uncertain jobs, and so they might just churn out of the program simply because they had a bad month, right? They lost a job, hours got cut, so that's the first group. The second group are those folks that either they have a disability themselves, or caregivers, or they have some other need that prevents them from working, and so they don't meet the work requirements of the program. Now, a counter to that is that, well, there are actually exclusions for these folks built into these work requirements. So if you have an eligible disability or if you're a caregiver, right, you're not subject to the work requirements. That's not what the evidence shows. The evidence shows it's actually incredibly hard to demonstrate that you qualify for these exceptions, even if you do on paper qualify for these exceptions, right? So that's the second group that's at risk. The third group that's at risk are just folks that get kicked off the program because of the procedures themselves, right? So this is that churn we talked about. Every new certification, every new verification, every new eligibility check, every single time you have to access a portal, people are gonna filter through one, or because of one reason or another. I think it's estimated that in the first period of like the Medicaid eligibility checks after they get implemented, 10% of people will lose access to Medicaid just in those first 6 months. 70% of whom qualifies for Medicaid, right? So this administrative churn is going to kick a lot of people off the program. And then there's the fourth group, the people that are able-bodied, they could be working, they're not in education, they're not seeking training, they have no interest in work. Those are the people that these reforms claim to be helping. Guess how many people fit the bill on Medicaid of like able-bodied people who could work it up? Any guesses? Give me a percent. 2% of people on Medicaid are able-bodied, not in employment, not looking for jobs. That's who we're trying to attack with these work requirements. And we're going to end up taking up a lot of other people off these programs because we're trying to target that 2%.
Yeah, I think the thing that I'll just like highlight from what he had said was it's not work requirements, it's work documentation, right? Again, it's yes, you're working, yes, you're caregiving, yes, you're all of these things, but it's getting into the portal and submitting your pay stubs if you have them, if you're just working on the side. So it's not just work requirements, it's work documentation requirements.
I would add, we don't do advocacy, that's not our role in this, but as you all think about that component, I think Stephen and Kristen did a really great job of laying out what those administrative burdens look like. I think it's also important to think about as you shape your own view of advocacy or what actions can be taken to mitigate, recognizing that the administrative burden gets to the point. Like there are dollars that are being reduced significantly, and that matters. That's sort of what gets the headlines. But the things that they've talked about here today are the things that are going to take eligible people off these programs. And so as we think about how to orient ourselves towards response, I think we have to be cognizant of that and how we talk to legislators and government agency folks, and also recognize that there is an opportunity to fill in those gaps where philanthropy or local governments can't make up for the dollars that are being cut. There are other investments that can be made, whether it's around navigation or additional assistance in helping people with that documentation, understanding the new requirements that can be made to mitigate some of the worst impacts of this, or at least reduce that burden.
Anybody want to respond to that?
Yes.
I'll respond in part. So we heard efficiency mentioned a few times in the discussions here. And so I'm wondering, what would that look like on the ground in St. Louis between nonprofits, researchers, philanthropy, community organizations, and what needs to be coordinated now before families begin to slip through the cracks?
I'm going to say one efficiency that's bigger than that a lot of other states have is one application that will allow families to get WIC and Medicaid and school meals and SNAP, where you don't have to have multiple call centers and multiple application and multiple requirements. over and over again with different deadlines and different certification periods. So one efficiency could be that, update the systems where all of these information's held in to where one family could do one meeting and get all of the things that they need.
I love that.
I think,
Please go.
adding to that, I think Christine raises a great point, which is there are models for this, and to the extent that we can, as sort of advocates in our own space, elevate those models to the right people to show that we don't have to make this up. We don't have to be the innovators. Like there are things that we can do. Other agencies that are nonprofits and other states that are doing this work. The other thing that I think is important to think through here is what is the role of technology in helping to reduce the burden for these families? Are there solutions that exist or that can be easily devised to help streamline the application? So maybe on making this up, maybe from the state's perspective, they have a reason for having 5 different forms. Is there a way to use technology to allow that to be one form for the citizen that can then be transmitted to the correct personnel from the agency level? And
Yeah, but each one of our departments has a different system.
Yeah.
I mean, almost every state in this country are running this program model that allows any student or any child that's on Medicaid to automatically get school meals, direct certification to school meals. Missouri does not have that waiver because our Department of Elementary and Secondary Education cannot talk to our Medicaid department. So you can't easily connect that data together. I mean, a large majority of states do that alone, much less all of the other things. And it's because the Department of Social Services systems are from like 1980s. And I'm from the 1980s, so I can see it's very old, right? It's these green screens where you can only go through one screen. I mean, it's so old and it's going to cost millions of dollars to update it. I'm not saying it's not a challenge, but it's an investment that could make things so much easier for so many people, the individuals on these programs, number one, the department employees, number two.
Excellent. And I guess for Adam and Stephen, anything in the past of the city's efforts to fight poverty that makes you think about efficiency going forward in this domain? I'm thinking about Stephen's slide around the GBI and how things use it, but yeah.
So I'll defer to Stephen to talk about GBI, which I think is a fantastic program. I'm glad to see that it launched. I think in terms of what we've done, I mentioned ARPA during the presentation. The city allocated $2.7 million in ARPA money towards food assistance. 2.6 of that has been spent down. I think we still have some other spend down that we need to do for that. But I think also there have been a few other projects within city government that have launched to help sort of ease the burden for families, not necessarily going directly towards food, but in thinking about all these other, secondary and tertiary costs that folks have to navigate each month. And so we've done rental assistance programs out of DHS. A lot of our funding coming in from the federal government goes towards housing assistance, rental assistance, rapid rehousing, utility assistance. We launched the Impacted Tenants Fund and have expanded that program with an allocation of $1 million through the RAMS money. And what that is if you are displaced from your housing because the building division has condemned your housing because your landlord wasn't making any repairs, there's a one-time payment of cash that our department can give to you to help sort of settle you into your next location, which can be used for security deposit or food, diapers, $1,000 worth of fruit snacks if that's what you want. But it's money that goes towards a household for other expenses that can be purchased. I think outside of that, we talked about really tough decisions that have to be made. The city is facing a pretty tough budget projection, looking forward, and we have to think through how we can maximize our existing programs to get help directly into people's hands, letting them make the decisions on what they need to buy. Certainly food is going to be one of those major projects.
Yeah, I'll bring up just, I think, two important lessons from the guaranteed income initiative that the city ran. And the first, and this is not a surprise, I think anyone in this room, and even came up earlier, is that that program actually really revealed just how little financial cushion folks in the city had. I mean, you can see it in the impacts of the program, but you actually see it most clearly when the lawsuit against the city was filed against the guaranteed income program. So if you're not familiar with that, the city was running this program, it was humming along nicely. There's a lawsuit filed challenging the constitutionality of the payments. Judge essentially ordered a freeze of the payments immediately. And that led to an unexpected pause in the payments. The payments were $500 a month, which is a meaningful amount, but no one here would think that's enough to solve poverty, right? And what we saw is just that 1 month freeze actually sent a lot of families spiraling. They didn't have the budget for it. They reported being at risk of losing their homes, that they didn't know how to put food on the table, they were having to turn to payday lenders, things like that. In the credit data we saw, the payments started, and almost immediately folks' credit scores started increasing when the payments started because they were catching up on the payments. 1 month payment pause hits, we lose a lot of the gains we had from that program. So people were so on the financial edge. So that's sort of the first lesson. The second lesson actually came from the lawsuit itself, which is that the city actually demonstrated amazing capacity to respond to that, right? It was like the judge imposed this freeze, and then within a month, the city and philanthropy, JSMF and others had worked together to basically fill in the gaps, right? And so that's very encouraging that the city could respond to the crisis in that way. What worries me about this moment is that the crisis isn't just going to be like one acute thing. It's not a judicial decision, it's not a lawsuit. It's going to manifest as like the slow degradation of these programs as people churn it out, as each eligibility check, each recertification kicks a lot more people off the program incrementally. It's going to be this slow rolling crisis that I worry that oftentimes we're not as good at responding to as we are those acute moments.
So we have some time for audience questions, but before we do, I want to end with this for our panel right now. So what is the final takeaway you want the audience to leave with on how St. Louis can build a stronger, more humane, and less burdensome safety net? Each person.
I think I'll just reiterate my point that the focus is necessarily on what today's conversation is necessarily on Medicaid and SNAP, because those are extremely vulnerable populations, and those we know that those programs can cut substantially. I think the challenge here is, even as you are advocating for folks in those spaces, whether they be the people receiving those funds, the nonprofits who are adjacent to those programs, or whatever, that you think about the whole picture. So when you see that story about reduction in Missouri state budget, thinking about what that means both from the dollars available to fund these programs, but also the administrative capacity to carry out some of these things that may impact the forgetting the name, the rate for SNAP. But thinking about this from a systems level and understanding how we can interject things that help people navigate these systems through this change is what I would take away.
I think my takeaway is that there are a lot of opportunities for some very aggressive and targeted advocacy. A lot of opportunities for some dynamic relationships when it comes to philanthropy. I see St. Louis Community Foundation in the room, which has done some great things. James McDonald Foundation, many others. But I think there's a lot of conversations we should have about how government is working with the private sector to think through how we can fill the gap and meet the need. I think a lot of those conversations are starting in various pockets, and I'm happy that we're playing a role here today.
Yeah, just briefly, the one takeaway, we don't have to reinvent the wheel here. There are many states, many cities, many tech firms, just many organizations that have been working around the country to try to solve some of these problems about smoothing and facilitating benefits enrollment. And so I think we can learn a lot from them, and rather trying to Missouri or St. Louis develop their own new, innovations around this, learn from what others have done and coordinate across existing programs rather than trying to develop something new.
I think the takeaway I had is there's not one way to affect change in our community, that it takes all kinds. So it takes legislative advocacy, so calling your representatives and senators to ensure things change in the legislative process. Doing a lot of administrative advocacy, so working directly with the Department of Social Services to administer these programs. And then a lot of direct work, right? Directly working with clients and communities and helping them get food if they need food, or helping them connect to services if they need connections to services. And all of these entities are all vital to really reducing food insecurity in our state.
In the same theme, really just citizens speaking up, engaging in conversation with elected officials, with fellow citizens. Just recently, Healthy SNAP was pushed out to February 27th of 2027. And that was really due to a lot of advocacy that was going on. So we need to keep up the pressure, and we need to ensure that policies are designed with dignity and not with suspicion and retribution and shame.
Thank you. And we have some time for the audience. We want to have some time for a few questions here. Raise your hand, we'll get you a mic.
I really appreciated all the information that is provided. My question is, around the biggest. My question is, are there efforts, so maybe I'm just not aware of it, are there any efforts to integrate the resources that was from the different, different governmental agencies, advocacy groups, of private and public, companies to address all of the things that you all brought in. It seems that there's a lot of efforts that are being done to address the Medicaid that will deal issues that you all brought up, which are all in the system. But is there an integrated effort to address?
Talking specifically about some of the different departments who are running some of these different nutrition programs, not widespread efforts as in like combining technologies. That's not happening. But there have been efforts from different departments to do some of that. For example, WIC is administered by the Department of Health and Senior Services in the state of Missouri. Missouri Medicaid Department provides new Medicaid folks to the WIC department, and they can call and text them to see if they would be interested in applying for a WIC. It's manual and it happens, but it's not an automatic thing, but there is communication between those two departments. Additionally, the Missouri Sun Bucks program, which kind of came out of COVID, which is funding for the kids who were not in school during COVID or not in school during the summer, who were receiving school meals during the school year, were able to access about $120 of food benefits on a card for the summer when they're not getting school meals. That required some communication between the Department of Elementary and Secondary Education to provide those kids lists to our Department of Social Services to provide the EBT benefits. So that collaboration happened, and I mean, hundreds of thousands of kids received those benefits the last couple of years. So it's happening, not on a wide scale, but there has definitely been movement more cross-department collaboration in the last few years. So I see that as some good signs of hope. I mean, quite a few states decided not to run the Sunbucks program, and Missouri has for the last now 2 years, and it was funded again for 27. So that provides hundreds of thousands of kids with additional funding for the summer. So that's a bright spot that some states aren't doing.
I would say the things that I'm aware of, obviously there's a lot that could be done and a lot still to do. The work that I shared today was originally oriented towards the funding community, the philanthropy community. And one of the things that they did as they received that work was the St. Louis Community Foundation reached out to their network of nonprofits locally to convene them, to understand what this landscape looks like, and also to think through, to encourage them to begin thinking through how they could better coordinate across agencies that are sharing similar missions to, again, make the most of those dollars. And so I'm aware of some conversations that have come out of those kinds of meetings to, again, raise that awareness and figure out how do we begin to coordinate within the nonprofit philanthropy community to be responsive on an ongoing basis to this new reality. So there are the beginnings of these things that I'm aware of. I think there's really a desire to see those efforts continue and to expand, but I think it's happening at the agency level, it's happening at the nonprofit level. We're still really relatively early into this, and so as we think about the capacity for these individuals at these organizations on the ground, we have to remember that they're still delivering on their day job, and allow for some grace there. But there's absolute interest, and there is the beginning of coordination happening.
Thank you. And we'll close with a question from Zoom. So the volume of terminations from Medicaid will likely lead to an increase in emergency room visits across the region. Is there any research that quantifies the cost of our health systems will incur as a result? And I'll just add part of like, or anything health systems should be thinking about doing right now.
Yeah, I don't know about, I mean, other than saying the cost will be high. And the cost will be much higher than if those folks had just received preventative care or gone in when it was an emergency. But I don't have numbers for it. What I will say is one thing we haven't really talked about in this panel, because it's kind of detailed, is that OB3 also changes the ways that states and hospitals can fund themselves, right? So it's actually going to remove, I believe, states' abilities to collect taxes in order to actually fund hospitals and change what hospitals can ask for reimbursement for. So it's actually going to reduce the fiscal capacity of hospitals to provide services, even as it reduces the fiscal capacity of states to provide health insurance for low-income folks. So I think that there's going to be an increase in costs from emergency room visits and also a decrease in revenue for the hospitals, especially rural hospitals. And so that's going to lead to, I think, joint constraints coming from multiple sources.
Thank you, Stephen. And on that note, we are going to have to end, but I encourage folks to have questions or comments to host the panelists as we wrap up here. So I want to say a few people. I want to first thank our panelists. I definitely want to thank our senior policy fellow, Stephen Roll. I want to thank CSD, and I want to thank all of you for spending your time with us this afternoon. So let's give a round of applause.